Medic Dispatch, Cameron speaking.
We saw on the 12 lead was
I'm the medical director for Medic Ambulance, and the state was looking for demonstration projects in the community medicine area. We felt this was a great way to demonstrate the triple aim of the Accountable Care Act, and that is to improve patient experience, improve population health, and decrease per capita costs. Basically, this program works on keeping patients that recently admitted to the hospital out of the hospital. So many times there's been a failure of the medical care system that patients get discharged and then readmitted over and over again. This program works to decrease those readmissions. That improves patient experience because the patients want to be at home and they don't want to be sick, and this program does a perfect job of that, and I think will really demonstrate the real value of community paramedicine.
I think that's something that we've done phenomenally as two organizations over the last 18 to 24 months, literally finding out what they need and what their patients need, and how can we use this program, the state-of-the-art, innovative, whatever words you want to use this program to meet those needs.
I'm a heart failure complex case manager for NorthBay, and one of the things that I and my coworker do, we evaluate patients for our program or for Medic's program, and if they're appropriate to be referred to Medic, then we work on providing that referral. We also make sure that the primary care physician and the appropriate specialist are aware of what's going on with their patients as well.
I think that Medic's community paramedic program was well thought out. The paramedics seem to have the most appropriate education in terms of the chronicity of disease, and I think they're able to address the patient's concerns regarding discharge, effective discharge plans, perhaps voids in their understanding of their disease process. They connect patients with community providers, with our providers. They alert us if there's any issues with care coordination. It's been only positive outcomes.
She moved here from Texas a few months ago, and she came out here with very limited resources. One of the first things I helped her do was establish insurance to the state of California, and that's a lot of in-depth phone calls, which she had no experience making. After that, helped her establish a primary care physician. Unfortunately, primary doctors only give you a month and a half till the next appointment, so through the state I was able to get her special insurance, which allowed her to get next day appointment so she could get her medications. One of the big issues was when she came out from Texas, she only had approximately 2 to 3 weeks worth of medications, so that wasn't going to last a month and a half, and she has a lot of concerns that need to be managed by those meds. So with that next day appointment, she was able to get all those prescriptions refilled, keep everything flowing like it should. After that, I helped her set up further pulmonologist, cardiologist appointments, etc.
They're there for you, and they will help you through and take care of the business part and calls.
It's amazing how much improvement you can see in her face, the life that came back in a month's time.
When he had to leave at the end, I didn't want him to go yet. So he was a great help to me.
When you talk to somebody, you get more than just those 10-minute scene times. You get 2 hours. You can get to know them, get to know their ins and outs and the issues, and it really allows you to get deep into why are these people having trouble? What is this little problem that's being compounded, and then it results in them going to the hospital? And once you find that, you can try and help fix it as best you can.
If I get sick, they're gonna be there for me, and that I'm not alone, and that there's somebody that's gonna be there. Like I know if I go back in the hospital and get out, I'm sure Cliff or somebody will probably come and help me out again.
So when I first heard about the initiative, I'll admit I was a skeptic. I was not sure how we could take on this project with current staffing. I thought this would be way too much work for the case management staff to take on. I was I just did not see how we could possibly do this. I didn't think it was going to be enough value add for NorthBay to take on. So I was a skeptic.
When you're a paramedic, you're trained to get into a house, be there in as little time as you can and get that patient to the hospital. What's different about this program is you're actually trained the exact opposite. You go into a house and you're there for an hour, 2 hours. You're going over everything with the patient, all of their medications, all of their diseases, explaining the disease and the disease processes to those patients, and just really getting to know the patient on a one-on-one basis rather than a 10 minutes inside the house, a 5-minute transport to the emergency room, and then drop off, where your total time with the patient is 20, 30 minutes. Now it's 2 hours, 3 hours, and you actually develop a relationship with that patient and want to see the patient succeed and want to see the health of the patient improve.
Then I did more research, just a Google search, and saw the state of Texas had been doing this for a while. There's other counties in California that have similar pilots going on, and then started to be less of a naysayer and open to the possibility of this could work for our NorthBay patients. So, and then meeting Jimmy, that helped as well. Then going out to the medic office in Vallejo and seeing how organized they were around the pilot, that really helped as well.
NorthBay is vital to us being successful as a program. We have to work collaboratively with them and their team to ensure that we're meeting the needs of their patients.
The communication between NorthBay and Medic Ambulance has been stellar. I pick up the phone and I'm speaking directly to the case managers that are dealing with the patients firsthand in the hospital, helping coordinate their care. They're on the phone to me on a very regular basis. We have each other's direct lines, and there's a great communication to make sure that the patients don't fall through any of the cracks.
There's so many patients that could use our services and medic services, so that we do have to really evaluate who we feel that are the most appropriate and who really need us more urgently. So that's why it's so good that medic's there, so that they can pick up some of the patients that we cannot follow, and we can team up and make sure these patients get what they need to succeed.
If there's anything outside of the ordinary, any unforeseen problems, whether they need a pain management clinic or they have a lapse in their insurance coverage, anything like that, they're on the phone with me immediately, and I'm immediately on the phone with their case managers at NorthBay, and as a team, we figure out what we need to do for this patient, coordinate their care, follow up with it, and we don't call it case closed until all their needs are met.
Bringing the education into the patients' homes is paramount here. And that is something that we at NorthBay have not had the resources to bring to date. But this has been, it's excellent. It's just well thought out, it's excellent. And I just came from a behavioral health symposium for California Hospital Association, and I have to tell you that the community paramedic opportunities were mentioned in several sessions.
It's not just going to be about picking somebody up, taking them to the hospital. It'll always be that, but we need to figure out what's the extension of that. How do we keep people from activating the 911 system? How do we keep them home healthy and educated? Those are the important things that this program's going to do.
I'm hoping that when this program comes out, that this program is replicated throughout the country and everyone can take advantage of the same program that the residents of Solano County can now take advantage of.